All right. Bonjour, Anine. Good evening. Thank you all for being here with us. My name is Lindsay Petrus, and I'm the Cancer Program Manager here at ACAF. I work and reside in northern Wisconsin on the homelands of the Bad River and Red Cliff bands of Lake Superior Chippewa Indians. The Treaty of La Pointe was made with the United States and signed on Madeline Island on September 30th, 1854. Today, the band is reclaiming their rightful land and ensuring their culture is preserved and practiced. We are recording this webinar, which will be uploaded to the ACAF YouTube channel. Please check out our channel for other informative webinars. Tonight, we will be discussing the role of pain management in your survivorship journey. Joining us are three esteemed guests to discuss this important topic. Please be sure to put your questions in the chat box on either Zoom or Facebook, and we will try to answer them all after the presentations are completed. We'd love to know where you're tuning in from, so please feel free to share in the chat. And now, just a little hiccup there. There we go. So we will be doing introductions. We'll talk about the ACAF background and vision. We'll be doing our presentations, and then we'll be able to take questions. So tonight we have with us Ann Skyra Brown. Ann has worked as an oncology nurse for over 25 years. She currently serves as an oncology nurse practitioner at Essentia Health, which works in the region in and around Duluth, extending up to International Falls border and as far south as Northwest Wisconsin. She typically works out of the Duluth-based clinic, but travels once a week to bring oncology specialty care to Hayward, Wisconsin. Her specialty lies in chemotherapy, immunotherapy, and the various oral cancer therapies. She has a particular interest in helping patients and families manage the physical and emotional symptoms of cancer and its treatment. Helping to manage nausea, pain, and other side effects is an important part of promoting the best quality of life for the patients and families experiencing cancer journey. Next, we have Dr. Sarah Astorga. Sarah completed her training through the Indiana University School of Medicine and Franciscan Family Medicine Residency Program in Indianapolis, Indiana. She then completed a fellowship in integrative medicine at the University of Kansas in Kansas City, with a partial emphasis on integrative oncology practices. She has been with the Essentia Integrative Health Program since 2018, with a special interest in supporting oncology care, as well as using food as medicine, stress management, and gastrointestinal concerns. She and her husband have acclimated well to life in the Northland, enjoying mountain biking, winter camping, and adoring their cats. Next, we have Emily Heiss-Julian. Ms. Heiss-Julian has been providing care in the Twin Ports area as a licensed acupuncturist since 2008. She is a graduate of Northwestern Health Science University. In 2019, she began working in the Integrative Health Department at Essentia Health, and her treatment space is located within the Oncology Department in the First Street Clinic. Recently, Emily began oncology acupuncture studies through the Memorial Sloan Kettering Cancer Center. She has a passion for healing and understanding the root of imbalances in disease, and a deep compassion for those who are facing challenges. There we go, background. American Indian Cancer Foundation is a national nonprofit established to address tremendous cancer inequities faced by American Indian and Alaska Natives. Our mission is to eliminate cancer burdens on American Indian families through education and improve access to prevention, early detection, treatment, and survivor support. Our vision is a world where cancer is no longer a leading cause of death for American Indian and Alaska Natives. Through hard work, culturally appropriate community-based programs, and policy change that affords Native people access to the best prevention and treatment strategies, we see a day where American Indian communities are free from the burdens of cancer. So now I will invite Ann to either share her screen or start her presentation.
Okay, I would like to share my screen. So I'm going to go ahead and do that. And I'm hoping you all can see this. Oh goodness, now how do I get rid of this bar up here? There we go. So I'm humbled actually to be here with you tonight. And I consider myself an ongoing learner. And I learn a lot from patients every day who are brave enough to be part of showing up, to learn about their health and ways to take care of themselves and their families through the cancer journey. So I thought it would be helpful to first, let's see. There we go. Talk about what is pain. And I'm going to tell you my bias as a nurse in, traditional clinic setting or hospital setting is to talk about the science and be kind of clear about definitions. And the International Association for the Study of Pain offers, I think, kind of a good overall definition. They just updated it after 20 some years. And they talk about pain as an unpleasant sensory and emotional experience that's associated with actual or potential tissue damage. There it gets a little nursey or sciencey on you. But I like the part about it's about the senses and it has an emotional aspect to it. So that's a broad understanding. And I think it's so important for us in the medical profession to understand that pain's a personal experience. And I'm going to encourage you all to claim that. And tonight I'm going to talk more about physical pain. I know that there's a lot of aspects of emotional pain and spiritual pain that might affect people through the cancer experience, but it's a personal experience. It's influenced by biology. It's certainly influenced by our whole psychological makeup, and then how we live within a social group or within the community where we live. And it's really learned over life experiences. We learn as a young child. I know I did. Go ahead, get up, you're not hurt, or there might be people who have experienced, a lot of loving tenderness through pain, but we certainly are influenced by a multitude of factors. But the International Association for the Study of Pain says a person's report of an experience of pain should be respected. I can't say in a busy clinic setting that I see this happen on a day-to-day basis, but I'd like to talk to you a little bit about how you might be able to create that. I'm going to talk mainly about cancer pain. That's what I know the most about. I know that pain can change over time, and it truly has a lot of effects. Some might be positive, but I've seen a lot of negative effects on how a person living with cancer can function, can be part of their group, personal relationships, family relationships, and the bigger community, and work setting and beyond. And, I'm going to talk a lot about how important it is to express pain, but verbal description is really only one of several ways. So I won't be able to cover all of this in the 15 minutes that I have tonight, but I want to kind of give some background that pain is a big concept. In terms of learning about cancer pain, what I hope to cover in the 15 minutes that I have is the causes of the physical pain that someone living with cancer might experience, the different types of pain, how we think of that from the science community, some of the medications that we use to treat pain. And I'm going to touch upon other ways to treat pain, but I think my colleagues, Emily and Sarah, are going to do a better job of that. So I will leave that to them when it's their turn. So in science, the typical, technical terms might be a little much, but these are the major types of pain. The fancy name for tissue damage is nociceptive. That just means that somewhere I put my hand on a hot stove, my fingers sense that, and it sends a message to my brain, ouch. So, and that's tissue damage. A burn can be tissue damage. Inflammation can be kind of pain, and that's when the body's immune system is just trying to protect us. Maybe I sprain my ankle and inflammation happens to try and protect that joint. It gets swollen, it might turn red. It's a lot of inflammation that my body's immune system is just trying to do to protect me. Neuropathic pain is pain that is triggered by nerve irritation or pressure on a certain part of the body, and functional pain. There's no obvious cause, but just pain. So those are the major categories as I think about pain. In the cancer setting, you'll notice over to the right, I've mentioned most of these, all of these actually, from the cancer itself to surgery to procedures, all have some aspect of Tumor pressing on nerves or bones, that's tissue damage, possibly nerve pain. Bone pain can be caused from the cancer itself, be it cancer that spread to the bone, or some of the treatments that people might go through. Surgery can cause pain. That's usually tissue damage, an actual cut on tissue to remove a tumor. Typically, that would be days to weeks, whereas some of the other pain I'm going to talk about can be ongoing. And there certainly is a phenomenon called phantom pain. Someone might need to have an amputation from the sarcoma they experience on their leg, but they continue to feel pain all the way to their feet, even though the foot is absent. And that's a real phenomenon. There's a message that gets sent to the brain that says that hurts. Certainly people going through cancer treatments go through a lot of procedures and testing. Everything from lying on an uncomfortable table to be scanned to having a biopsy can be painful. My specialty, as Lindsay mentioned, is chemotherapy. And there's a lot of side effects from chemotherapy, but it certainly can cause nerve pain. It can cause mouth sores. Some people have a lot of skin changes, and we're just beginning to understand immunotherapy and all the way it causes side effects, from bone pain to changes on the skin that really affect, they cause inflammation and people can't open doors, or we have a lot to learn about how to work with some of these, but chemotherapy can cause pain, as can radiation. And that's actual tissue damage, laser type rays that cause mouth sores or skin changes, sometimes some long-term scarring, or even those who get radiated around the esophagus have pain with swallowing. We talk a little bit about three basic categories of pain by their timing. Acute pain can be sudden and it's brief and it doesn't give you a lot of notice. That's usually a short-term kind of pain, whereas chronic pain kind of enters into pain that's lasted for several months. 3 months, 3 years, 3 decades, it can be ongoing, and it's going to be there until the source of the pain is gone. And then some of us use that term breakthrough. Certainly the National Cancer Institute and those people I work with as I'm trying to help them manage their pain, talk about pain that even though they might be doing something to treat that pain, it still shows up. So timing can be an aspect of looking at pain. I'm going to talk a little bit about the different kinds of pain medication. This might be a bit elementary, but I think it's important for people to understand that there are many ways that pain medications are delivered, from being a pill or a capsule, a liquid. Some people use a spray, or even there's suckers that people can use, almost like a cough drop, but actual pain medication in a sucker form. There can be skin patches. Those have fallen out of favor to a certain extent because they don't always absorb well. Some people actually insert via the rectum some suppositories that offer pain relief when we can't use the mouth, or another form of getting pain medication to people. I think when I was a kid, and I still oftentimes think about injections, needles that actually deliver pain medications, from a small one that goes just underneath the surface of the skin to the deeper ones like the penicillin shots I would get, or some of the drugs that we give now. And IVs certainly are a way that I'm familiar with chemotherapy. There's certain people that are on pain pumps too. The typical medications that are used to treat the pain that I see day to day and that you might already be taking in your day to day as you deal with the pain that comes up, but are the medications like Tylenol, also known as acetaminophen. It's a very good medication. It reduces pain and fever. I remember hearing one of our most experienced doctors, I'm not going to say elders, but talking about some of the studies that were done at Mayo Clinic, and they compared some really powerful medications like morphine to Tylenol. They saw very equal results. So I think some people take some of the over-the-counter medications lightly. They can be helpful. They also have some side effects that can be potentially harmful. And I'd ask you to be careful as you think about over-the-counter medications. For example, Tylenol used to excess, especially if we're not counting in some of the other forms of it, can be harsh on the liver, as can things like ibuprofen and naproxen, which are also known as non-steroidal anti-inflammatories. The big difference between those two is the ability of those drugs to treat inflammation. We use steroids similarly, things like dexamethasone and prednisone to reduce inflammation. I sometimes work with people who have a lot of nerve pain, and some of the antidepressants can be a very powerful way to otherwise treat pain that we can't treat with more typical medications. And we use some anti-anxiety drugs because there is a lot of emotional anxiety and sometimes physical manifestations of anxiety that affects people's experience of pain. But especially with muscle spasms, we'll use some of those drugs. Some people think about the opioids in different ways than I do, but these are the narcotic medications that unfortunately have a negative connotation. And quite honestly, I work with a lot of people who are afraid of the opioids, the stronger medications, realizing how serious their pain might be. I think there are some people that equate that to how serious their cancer is. These treat moderate to severe pain. They can be very safely prescribed and used, but there are special rules that are trying to help us do this in the safest way for individuals and then larger communities. They do require a written prescription, and some examples of those might be the drugs like morphine, hydromorphone, and the ones listed here. There are other medical treatments for pain. It's not just the medications, but actual surgery. Surgery can help alleviate some of the pressure from a tumor. We do nerve blocks at times. People with pancreas cancer oftentimes have a scope that goes down the mouth and helps block some of the nerves that might make pancreas cancer so painful. I'm not an expert in this, but there are some people who are, and they give epidural injections, which mean they insert a needle in through the back into the spinal fluid to give some anti-inflammatory medications. There's also radiation and fancier things that even predate my understanding, where they actually do ablation. They can use ultrasound guided catheters that help direct radio frequency or ultrasound to things like tumors that are on the liver. And then some people are expert in using actual nerve stimulation like TENS, which is a certain kind of physical therapy. That's how I think of it, intervention. Like I mentioned, some of my colleagues can talk more to acupuncture. I'm going to leave that to you, Emily. There are things like biofeedback machines that help people with sensors on the skin learn how to breathe or use distraction. You'll see some of that mentioned here. I think cold and heat can be very effective in helping some of the other medications we might use. And any number of these things can be helpful. I think pain, like I said, is a personal experience, and just as many people as there are might be as many combinations of how to use these to the best effect. I do some procedures where I use a lot of distraction. I try and talk to people about a peaceful place that they might go to. They can use some of the guided imagery to go to. I asked a woman the other day, did she want to go to the beach, or was she more of a sun kind of person? And she wanted to listen to music. And in the absence of music, I actually sang to her, "You Are My Sunshine." I have never done that before, but it was a very effective way. She joined me and she could breathe differently. So I want to just say that there can be a lot of power in things like breathing different, in things like taking yourself to a peaceful place, to relaxation. I don't know as much about hypnosis, but I just wanted to list some of the other non-medication ways to treat pain. There are a lot of barriers as I think about people entering my culture, which is a clinic. It's very sterile, it's very medical. I'm on a time schedule, but I think it's very important that we think about how can we remove some of those barriers, because only a person knows their experience of pain. We're really clear by the science that we do a better job if we treat it when it first starts before it gets worse. So I'm going to really encourage you to do the best you can to tell your cancer care team about pain. When does it happen? Where is it located? What and how does it affect your day-to-day? Bringing up pain can be an important way of recognizing that something's changing. Maybe the chemo's not working. Maybe you have something new and we need to adjust your treatment so it's the right thing. The American Cancer Society, in a very American way, says you have the right to be treated for cancer pain. But I do want to say that I think you have the right to ask for pain management that works. So I encourage you to try and use some language, because our cancer care team uses this language, but where is it located, like I say? And as best as you can, find the language that tells us, what's it like? Is it sharp? Is it kind of dull? And sometimes I look at people and I say, can you use any of those words? And they're like, no, but I feel like I have a chihuahua running up my leg. And if that's the language that works, try and help us understand. How strong is it? And I think an important aspect is, how does it affect your day-to-day life? What makes it better? What makes it worse? Are you taking other medications or using some drugs that you might not be willing to talk about so much? That's going to help us if we understand that. And what kind of things are you doing that makes it better? I think people can understand you better if you can share what kind of things work for you. So in closing, I want to say cancer-related pain can be managed. I don't think those of us who work in healthcare should be able to find many excuses for not working hard to try and help you find a way to talk about it that works for you. It doesn't have to be my language. There might be times that it's just too hard. And I find this sometimes. It's not just the older generation. It's not just people from cultures other than mine, but just when they really need to find someone that helps them voice the experience that they're having. But truly the best way to control pain is to stop it from starting or keep it from getting worse. And it might take us a while to get it right for you. So help us work to find the right combination that works best for you. And this is where I got my information. I think, Lindsay, you said you're going to post these. So check it out, and maybe we can talk later if you have questions. Thanks.
Thank you so much, Anne. That was very informative. Very grateful for that presentation. Now we can pass it on to Sarah.
Excellent. Great. I'm going to share my screen. All right, how does that look? Excellent. All right, thank you so much, Anne. That was excellent, and it's really a joy to be here with you all, and very grateful to be here tonight with you. My role as an integrative medicine provider and the role of integrative medicine in general with patients with cancer-related pain is really complementary to your oncology care team, such as what Anne would be helping someone with. My goal is to really help peel back some of the other layers that might contribute to your experience of pain and inflammation, and work with a lot of lifestyle factors to do that. As we just described, there are a lot of reasons for pain both during and after treatment. And something that I often can help with is even focusing on digestive pain or that emotional aspect of pain that can really change how you're feeling physically and legitimately change our physiology and how our body is responding to different things. Are you seeing the video on here? I can move that. Okay. So thinking about the layers of health and hoping to boost your body's resiliency to the experience of going through cancer treatment, I like to focus on a few different lifestyle factors like nutrition and food, movement, sometimes supplements when that's appropriate, and the very important emotional and spiritual aspects that contribute to the crisis of going through cancer. Nutrition is arguably one of the biggest places that I focus on with people. It can feel very overwhelming, but it can be one of the most effective things that can really help people to decrease pain over time. Food is really important for many reasons. It's information for our body. It obviously improves hunger and gives us nutrients, but it nourishes body, mind, and spirit. And especially when we're able to eat with others or cook our own food. And that can be really nourishing for our community. But food can be a really big challenge when you're going through treatment and after treatment, especially when you're dealing with pain. And it can be hard to know what the right diet is. Not everyone should fit into the same narrow diet. There's not one right diet for everyone. But often what I try to help people with is to shift towards some sort of what we would call an anti-inflammatory diet. So we know that certain styles of eating can legitimately decrease inflammation in our body and often help with many types of pain, not just cancer-related pain. So what exactly does that mean? That means eating a lot of whole foods. So looking at your plate and saying, I can recognize this as chicken with black pepper and spices. This is asparagus. Here's a salad, where I can list all the ingredients. I can pronounce all the ingredients on a package, and just trying to eat, a lot of whole foods. We focus a lot on healthy fats, adequate protein, low sugar. These are important to maintain weight, a healthy weight, not gain too much weight or lose too much weight while you're going through treatment. It can also help to maintain muscle mass, improve how our brain is feeling, and mood. So each of these can be really important. I've listed just a few examples of some of these. This is by no means an exhaustive list, but we try to focus on, olive oil, avocados, nuts, seeds, fish for healthy fats. Protein can include healthy meats, and whether you eat meat or not can also include things like lentils or beans, nut butters, even wild rice and chia or flaxseed have some amount of protein. Sugar can actually be a pretty big piece of this. It doesn't seem necessarily like sugar would cause a lot of pain, but sugar can be pretty inflammatory for some people. And I have a number of patients who have had a decrease in headaches, neuropathy, a lot of different forms of pain by lowering their total sugar intake. This doesn't mean you have to cut out fruit or, carbs or vegetables that would have more carbs like carrots. Those are perfectly great with a balanced diet, but more things like soda or really sugary drinks, more of the processed foods type things. Certainly we want people to stay hydrated. Sometimes going through treatment, people are experiencing a lot of digestive discomfort, and sometimes we have to add more or less fiber. It can go either way depending on what you're experiencing. We encourage people to use a lot of anti-inflammatory spices in cooking. These are things like turmeric, or curcumin would be the supplement version of that you might have heard of. Ginger, cinnamon, also herbs like rosemary and thyme. Using any of those can be really anti-inflammatory in our cooking. Now, this might be even more important after someone's going through cancer treatment to really help rebuild your resiliency and rebuild your nerves and rebuild your tissues, especially when you're going through cancer treatment. Day to day, you really have to eat what you can tolerate. So even if that is not on this list whatsoever, that is perfectly fine. And sometimes things that help during treatment would be things like bone broth or protein shakes, or really just eating what you can. If you are looking for more information on an anti-inflammatory diet or an anti-inflammatory lifestyle, the University of Wisconsin actually has some really great handouts that are free online. You just type in to Google University of Wisconsin anti-inflammatory lifestyle, and you can get some really good information. Movement or exercise is another one of those pillars, another one of those layers that we can use to help improve pain. A lot of forms of exercise might be safe during your treatment and afterwards, but you definitely want to check in with your oncology team, especially if you've had surgery or radiation, to make sure that whatever you choose is going to be safe. Movement can really improve stiffness and discomfort, but it also helps maintain muscle mass, prevent falls, can also help with some of the other things that contribute to pain, like poor sleep quality, can improve energy. It does not have to be a really intense form of exercise that one might choose, but sometimes it could be. But often people will choose things like walking or yoga, gentle stretching. Another interesting form that might be helpful is something like Tai Chi or Qigong. I'm definitely not an expert in these, but from what I know, it's a combination of gentle movements and breath work. It's kind of like a moving meditation, which has a lot of research behind it for benefiting people who are going through pain. I included massage on here. It's not really exercise, but it can be a form of moving blood, moving lymph, and improving pain for some people. This may or may not be safe depending on where you're at in your cancer treatment. So again, this is something you want to talk with your oncology team about. And it might not even be professional massage. It might be you doing some self-massage or asking a partner or family member to help with that. But that can also be a gentle form of movement. Sometimes we use supplements. A lot of supplements can have potentially serious interactions with prescription medications or chemo or radiation or before and after surgery. For example, fish oil we sometimes use for inflammation, but that can cause a lot of bruising and bleeding around surgery. So you definitely want to check with your oncology team frequently, especially if you're adding or changing supplements. Some of the examples that we might find appropriate are anti-inflammatory things that work somewhat similar to NSAIDs like ibuprofen. For the right person, they can give better relief, and sometimes they don't, but can be worth trying. These are things like curcumin or boswellia, and sometimes we use antioxidants. One that we commonly use for neuropathy would be alpha lipoic acid. Again, this can interact with diabetes medications, and so you just want to always double check before you start anything. But I do encourage you to, if you have questions about this and you're curious, definitely ask, because it might be appropriate. Another thing that can add just one more layer, one more notch to your pain treatment is aromatherapy or diffusing essential oils. You don't even have to ingest them. This can just be smelling them, using them on your skin with a carrier oil, or putting them in a glass of water next to you. There's some interesting research that this can improve pain and sleep. Again, this is not something you're going to reach for when you're having 10 out of 10 pain, but it could be part of what you reach for when you're experiencing pain. And finally, last but definitely not least, is thinking about the mind, body, and spirit aspect of pain. This is arguably one of the most important things that we should all focus on. There's a lot of research that supports that these can really improve overall pain amounts. They can be low cost, they can be fairly easy to do, and they can help us shift our focus from just experiencing the pain really intensely to allow our brain to perceive it in a different way and become less reactive to pain signals. This doesn't happen overnight, and I can't promise that it's going to work every single time you're in pain, but I do think that these techniques can be extremely helpful as part of your program to improve pain. And there's a lot of different techniques you can use. We often encourage people to seek out therapy or counseling. I love therapy and counseling. I think everyone should go at some point in their life, especially if you're struggling with more of the emotional type pain, but also physical pain. Sometimes they can teach you biofeedback, which is one way to relax muscles. Music therapy, as Anne mentioned, can be extremely helpful. One thing that I like to do is, if you can make a playlist somehow on your computer or phone, you can start with music that's maybe really frustrating and angry, and then move to something that's really gentle and happy. So you can kind of transform your mood. Sometimes that's helpful for people. Self-hypnosis can be really nice, but you need a teacher who is trained in that to be able to teach you. I don't think that it might be possible to learn without that, but I think that's what most of the research with hypnosis is, that you need someone trained in that. And then there are many types of meditation. So mindfulness is a very common one, where we're trying to help people focus on just one thing at a time. Often that's our breath or a sound or something that we're experiencing. Transcendental meditation is very focused on a particular sound and trying to block everything out. That one's, you also would probably need a teacher. Guided imagery, like Anne mentioned, having someone walk you through, I'm walking through a forest. What am I smelling? What am I seeing? What am I experiencing? A lot of deep breathing techniques, or something called a body scan, where we're going through our entire body and relaxing each piece one at a time. Also called relaxation response. EFT or tapping is a pretty cool newer technique called emotional freedom technique. I'll demonstrate in a second. And there are lots of phone apps that have both free and paid for content with any amount of these different types of meditation that you can try. I like to pick one, use all the free stuff, and when I'm bored of it, I just pick a different one. So feel free to use any of those. And certainly spiritual support can be really helpful. It's not something that's often discussed very much in a conventional model, and I can't say that I'm amazing at discussing it, but I think it's very, very important, and it's good to talk with your providers about it, especially if you're experiencing, any struggles in that area, or you feel like you need more support. If you're a very religious person, reaching out to your faith-based organization can be very helpful. If you find spirituality more in nature or community, you can definitely run ideas with us and try to think about meaningful and safe ways that you can foster that. So finally, I would love to demonstrate EFT or tapping. I imagine that a lot of you have maybe tried some deep breathing or guided imagery in the past, or if you haven't, please do that. Go to YouTube, type in 3-minute guided imagery, and tons of hits will come up. But EFT is one that a lot of people haven't heard of. It looks kind of strange and bizarre, but it can be really effective. It's combining kind of meditation and tapping on acupressure points. And it literally looks like this. If you wanted to join me, you certainly can. It's about 7 or 8 points on your upper body. And once you know them, it's really easy to run through them. If you listen to a YouTube video with it, you can type in EFT in pain or EFT in stress or EFT in anything. And a lot of hits will come up and they'll just walk you through what to be thinking about as you're tapping. So an example would be you start using one hand and you just tap on the top of your head. And they're literally telling you, all right, now just think about your pain. Where is it located? Now switch to the inner corner of your eye. Now think about transforming that pain. Imagine that it's being released completely out through your skin and out of your body. And they'll switch to the outside of the eye and they'll tell you more, better, helpful information than I can. But it's literally just 7 or 8 points and they'll run you through them under the nose, under the chin, under the collarbone. Then they'll start again. Once you've practiced that a few times, I think it feels really good and relaxing. And it's more of an active technique, especially if you're in a lot of pain and just sitting there doing deep breathing doesn't feel like you're doing enough. I think it's a really helpful way to combine those. Great. Well, thank you so much.
Thank you so much, Sarah. That was a really great technique for people to take away. We can move on to Emily. Emily, can you hear me? Well, we have a question from the attendees, and one of the questions is, how does your team address spiritual pain during the oncology journey?
That's such a good question. And like I said, I wish I had more training in this. I think it's a very, very important question that is often not addressed. And I think finding at least first someone that you can talk with about that is really important, whether that's a family member or a friend or a religious leader or anyone that you feel like you can connect with. I think it's important to discuss what exactly you're experiencing and definitely seek support that way. Sometimes a therapist or counselor can give more guidance, or a religious leader. But like I said, if spirituality is more found in nature or community, especially during COVID times, please, get ideas about how you can foster that. And Anne might have other ideas.
I think it's a great question, and I think we have to keep asking ourselves that. I think someone's asking about nausea, and I realize that there's actually a lot of distress or anxiety. We've tried to hook some of our folks up with the chaplains that are at the hospital, but that's not always what they need. I think being able to understand what might be helpful to someone is really important. Sarah mentioned it might be nature, it might be another spiritual leader, but I am convinced that sometimes, and I don't know what makeup we have here in terms of an audience. It looks like some of you folks are from cancer centers, maybe you're actual nurses or people who work with people with cancer, but I've really learned to, when people say something like, how do I tell my children I'm going to die? Because I've had questions like that. That's spiritual distress. I've learned to say, wow, that's a big question. What do you think? And I think sometimes the spirit pours out and people have a chance in that moment to express the feelings that need to come out. So kind of reflecting back has become something maybe in my wisdom, I'm learning and just beginning that learning process.
Thank you very much. That was very insightful. Emily, are you ready to share?
Yeah, I found you guys. I had 2 Zoom meetings going on. Are you able to see this?
Nope, we only see you.
Okay. Give me a moment. Okay, is this working for you?
Yes.
Thanks, Lindsay. And thanks, Anne and Sarah. It's nice to see you and hear what you're working with every day. And thanks to your organization, ACAF, Lindsay, I'm feeling really grateful to connect with you and to the community that you serve. It's an honor to just share a little bit of what I do and answer some questions in the end if we are getting there. All right, I'm having a little trouble. I'll pull it up again. Okay, so I've been at Essentia Health doing acupuncture for a couple of years now. I was in practice for many years before that. But I happen to be tucked into the oncology department. And this is very beneficial for the connection for offering care for oncology patients. There's more and more research coming out about how acupuncture can help support people going through cancer treatment and through survivorship. And that research helps us to provide the best care and offer the most relief for people. Today we're focusing on the relief of pain. The beautiful thing about East Asian medicine or Chinese medicine is that there never was really a division between the mind, body, and spirit. It's a unified theory of medicine. And so it works well to treat holistically. So just in this short presentation, I'm going to outline what acupuncture is, how acupuncture works, and that's going to come from two different perspectives. So like a more biomedical evidence-based perspective, and also from the traditional East Asian medicine perspective. So I'll go over, we've kind of covered the different types of pain that can occur with cancer and cancer treatment. And I'll point out the ones that acupuncture has been found to be helpful for. And then let's see what we have here. So acupuncture is actually a branch of traditional East Asian medicine. So East Asian medicine, some people are more familiar with calling it Chinese medicine, is thousands of years old. So it's really a medicine that stood the test of time. And to apply acupuncture, we insert fine needles into specific points on a person's body that can reduce pain and treat various diseases. So acupuncture not only treats pain in cancer and cancer treatment, but other conditions as well. So when I say acupuncture is a branch of Chinese medicine, the other modalities that your acupuncturist might provide for you include herbalism and different physiotherapies. So kind of what we've been talking about, cupping, tuina, and gua sha are different ways to get the energy and the blood moving in a person's body. So in the United States, our acupuncturists are licensed by the state medical board, and we're seeing more and more the opportunity for acupuncture to be used in a clinical or hospital inpatient setting and becoming a critical part of integrative care. So this is from a biomedical understanding of how acupuncture works. A lot of my information this evening is coming from coursework through the Memorial Sloan Kettering Institute Cancer Center. And so I'll kind of break it down in a few simple ways. When a needle is inserted into a specific point on the body, there is a message that is sent to the brain that releases opioids or different endorphins, and this offers pain relief. And so we're also seeing here affecting the limbic system. The limbic system is the part of our brain that reacts and responds with fear, stress, anxiety, or worry. And so it's naturally a part of the circuitry when a person is experiencing trauma, chronic or acute pain, and just fear of their future care, or what might happen in the future. And so with the acupuncture, it helps to calm down this part of the brain. And so it has a profound effect on offering a state of calm and relaxation that can be long-standing. So there's been some studies to show through MRI the different activations that happen in the brain when acupuncture is applied. For example, when treating dry mouth due to radiation, a person can both receive acupuncture and have a functional MRI at the same time. And we can see the part of the brain that produces salivation light up. And it's pretty cool. So go back here. So this is all in the works. Acupuncture research, is really in the last 30 to 50 years, I would say. And every specific thing that we find out about how and why it works helps us to provide better care. This is how my brain operates. The traditional theory behind acupuncture and Chinese medicine, because it's thousands of years old, it was built in reflection of our natural environment. So when a person has pain, we put in a needle and we see that it is moving the qi, which you can think of as universal life force in your body, and it moves the blood. And by doing so, that can offer relief of pain. There's also a lot in our medicine about creating balance in these different meridians. So the meridians, the qi and meridians, are kind of the basics of what we're working with. Meridians are the like currents or rivers of the qi that flow through your body, and they have an effect on the different systems of our body that we're more familiar with, like our digestive systems and our musculoskeletal system. So as I was saying, when this medicine was developed, the people were looking outward to the natural environment and seeing the same interplay of energy within their own body, and then trying to bring those elements into balance in order to create greater health and longevity. So for my perspective, and maybe from this medicine's perspective, this is a part of the emotional and spiritual well-being of a person, and how acupuncture can help to support that. When one feels connected to the universe, that connection can offer safety and support and healing, and just a better emotional well-being. So you may have seen this or heard about electroacupuncture. Some of the research is specific to this, and I just want to let you know that this is when an electrical current is passed between, is stimulated on two different acupuncture points, and by doing so, it can create a kind of a pulsing sensation between those needles or different acupuncture points. Sometimes just a sticky is put on to a person's body, and the electrical stimulation is felt through there. So even though this is a recent adaptation to Chinese medicine and acupuncture, it really follows suit with what we think of as how acupuncture works. When we're using just manual stimulation of the needle, we use it in a specific way to create what we call da chi. So there's a certain point when you're stimulating the needle where you can feel the body grab onto it, you can feel full sensation, and you're always looking to connect to that in practice, to know that you're making a connection to the energetic body. So there's been a lot of evidence-based research to show the effectiveness of electroacupuncture. And so your acupuncturist may offer that to you, and they may not. It depends on what type of pain you're having and if it might be helpful for that specific pain. So these are the kind of different types of pain that acupuncture can help with. Acupuncture can help to address cancer-related pain, so pain from tumors or compression to surrounding areas from tumors. So both primary cancer pain and metastatic cancer pain. It can certainly, and I would say probably the most we have to offer to the field of cancer care is helping to alleviate treatment-related pain. So the effects from chemotherapy, including neuropathy, and also from surgery, and from different medications. So kind of like Anne was talking about, there's neuropathic pain, and then there's this nociceptive pain, and you may have both. And also you may have a pain that already existed before you started into cancer treatment and long-term care. And those can be addressed too. Because as we know, any type of pain has a profound effect on the mental health and our emotional well-being. And that's this psychosocial type of pain. How is this pain impacting your emotional and mental well-being, and how can acupuncture help to alleviate that in a way? So a little bit more details on treatment-related pain. Just like I said, actual tissue damage post-operatively, acupuncture can be helpful for and help the tissues to recover. So neuropathic pain, acupuncture can be helpful for. I would say this third point of joint pain, acupuncture has been found to be very helpful for. And that can be related to different medications such as aromatase inhibitors, or medications that help to benefit the white blood count, such as filgrastim. And this is important because acupuncture might help a person who has been recommended these medications for their treatment. It can help to be able to adhere to that treatment plan if you are not experiencing as severe side effects from these medications, which in turn can help to improve your long-term survivorship. Let's see here. So lots of people want to know what their treatment plan would look like. So if a person is receiving active treatment, chemotherapy or radiation, it can be very helpful to receive acupuncture about once a week. And if you're having maybe more persistent or more severe pain, it might be helpful for a person to come in twice a week, especially when you first start with acupuncture. Your acupuncturist might even suggest 2 to 3 times a week to gain momentum, kind of like Anne was saying, to get a grip on that pain before it becomes worse. I always like people to know that the effects of acupuncture are cumulative. So you may get relief from after your first treatment, but it's not uncommon for it to take 4 to 6 treatments to start to notice a difference with your acupuncture treatments. And that's helpful to know that it's not like a magic pill type of treatment, which I think culturally we are getting out of that mindset anyways, that just kind of a one and done and you're fixed. I don't come across that very much anymore. So it's an ongoing support. And I think people really find that the positive side effects of acupuncture, such as that deep state of relaxation and alleviation of stress, make it very worthwhile, and people look forward to these treatments as a way, as just a strong support through chronic pain. And so when a person is not going through active treatment, I can plan to see them every 4 to 8 weeks or as needed for a person. So, and it's not uncommon then to have another more intensive series of treatments, acupuncture treatments. So I just wanted to let you know, acupuncture has been found to be helpful for treating pain in cancer care and in cancer. But these are some of the other benefits that we've seen through research. I would say most commonly nausea and vomiting with chemotherapy, and hot flashes and anxiety. Those are more commonly treated and have been shown to have the highest relief with acupuncture. And then fatigue, dry mouth, or xerostomia, and insomnia. Also, acupuncture can be beneficial for those things. So these on the right here are some of the benefits of combining and integrating both acupuncture and drug treatment. So really, acupuncture is an adjunctive therapy that can help to treat a person's ongoing cancer treatment. So you might see a longer duration of pain relief. It may take you a shorter amount of time to get relief of pain. And that can be beneficial because you're not reaching for those medications that treat acute pain as often. And obviously better quality of life when you're experiencing less pain and a better mental state. And when a person is recovering potentially from chemotherapy with like neuropathy, you might recover from that neuropathy more quickly and with longstanding relief. And like I mentioned earlier, something I'm really excited about is to offer the, care to people so that they can continue with their recommended treatment plans and maximize their care. The American Society of Clinical Oncology has recommended acupuncture as an adjunctive therapy in cancer-related pain. So it's a worthwhile thing to consider. And so I just want to credit the Memorial Sloan Kettering Cancer Center and their educational expertise and research in oncology. And thanks.
Thank you so much, Emily. So I realize we're over our time, but I do have one question for each of you, and hopefully it's a quick question, but what is one takeaway you hope the viewers will get from these great presentations?
I can start. I would say my takeaway would be, don't give up if you try something and it's not helpful. Keep trying other things. Like, for example, with meditation, if you try one and you hate it, don't do that one. Try something different, or try focusing on food for a few weeks. Definitely try acupuncture and continue your medications. But not everyone will have the same effects from each treatment. So try a number of them and see what works best for you.
And I know I emphasized this a bit when I was talking, but I'm just really struck by the fact that we ask people to put their pain on a scale from 0 to 10. We prime them with certain ways we'd like to describe, but I'm going to encourage us all to try and be more creative. And those of you who don't feel heard, keep speaking. I think we can learn to listen better.
Yeah, I just really want to honor meeting every patient where they're at. That's can be really important. Not everybody wants or desires the same thing in their care, and your feedback is really important for how we can serve you best.
Well, again, I'd like to thank you all three for joining us tonight. This has been very informative, and we're very appreciative for each one of you, educating us. So thank you so much. And thank you everyone for attending. Have a good night.
Miigwech. Bye-bye.